Hello everyone. So, in the morphological classification of fungi, we are done with yeast like budding, and now we are doing moulds. So, in the moulds, we are done with Aspergillus and Zygomycetes. Now we will see Dermatophytes. So, Aspergillus, it's a ubiquitous, it presents everywhere, and it's an opportunistic pathogen. Coming to zygomycetes, so in zygomycetes, rhizopus, mucor and absidia. So we have seen the differences between these three, and they are soil saprophytes and present in decaying vegetables and also in manure. So when there is a so these zygomycetes are normally avirulent, but it causes disease when there is general resistance is extremely low. So coming to dermatophytes, derm, the name itself is saying superficial. So let's go to the dermatophytes now. So dermatophytes are filamentous fungi that infect only superficial keratinized tissues. What are they? The skin, hair and nails. So dermatophyte, the name itself is saying superficial. It causes superficial, it infects superficial keratinized tissues, not cutaneous. So it breaks down keratin and utilizes it. So coming to the pathogenesis, dermatophytosis or tinea or ringworm, there is a hypersensitivity due to fungus antigen. So it causes lesions called dermatophytids or ID reaction. So scalp infection sometimes produces boggy lesions with marked inflammatory reaction called carrion. So dermatophytes can be asked as a short or as a long note. It can be asked the common pathogenic fungi affecting skin, or the laboratory diagnosis of superficial fungal infections. So you can write dermatophytes uh, are superficial fungi. So you can give in detail about dermatophytes in superficial fungal infections or fungi affecting skin. So coming to the classification of dermatophytes, it is classified as in three forms: trichophyton, microsporum and epidermophyton. So these trichophyton infect skin, nail and hair, whereas microsporum infects hair and skin, whereas epidermophyton infects skin and nail. So, depending on their natural habitat, dermatophytes may be classified as anthropophilic, zoophilic, zoophilic. So, anthropophilic, they are often transmitted from one person to another or by contaminated objects, example clothes, hats, hairbrushes, and generally cause long lasting infection with mild inflammation. So, coming to zoophilic, it is from animal to human beings, and these are transmitted to humans from soil. So what are species come under anthropophilic? So microsporum odoni, epidermophyton flocosum and trichophyton rubrum. So in zoophilic, microsporum canis, and zoophilic, microsporum gypsum. So coming to the clinical types, dermatophytosis, or it is called as tinea or ringworm. So disease, site and causative agents. So tinea capitis, the site is scalp, and the species are trichophyton species and microsporum species. So tinea corporis, or called as tinea glabrosa. So the site is smooth and non-hairy skin of the body. Causative agents are Trichophyton rubrum and other types of dermatophytes. So Tinea cruris, the site is groin and perineum. So the species are Trichophyton rubrum and Epidermophyton floccosum. So Tinea pedis, athlete's foot it is called. So the site is foot, and the causative agents are Trichophyton rubrum and Epidermophyton floccosum. Tinea barbae, so it is also called barber's itch. So on the bearded areas of the skin of the face and neck. So the species are Trichophyton rubrum and Trichophyton mentagrophytes. Tinea imbricata, so the site is papillosquamous scaly patches. The causative agent is Trichophyton concentricum. So ectothrix hair infection, endothrix hair infection. The site is hair. So the species are Trichophyton rubrum, Trichophyton mentagrophytes and Microsporum species. Coming to endothrix hair infection, the site is hair, and the species is Trichophyton violaceum. And coming to favors, the site is hair. So there is alopecia and scarring. So the species are Trichophyton violaceum and Microsporum gypsum. So you can give this for a short note, the clinical types, the disease, site and causative agent. So you'll score good marks. So coming to the lab diagnosis, the specimen is skin, hair, nail and ringworm lesions. So coming to direct microscopy using KOH mount, for skin and hair 10% KOH, and for the nail using 40% KOH. So coming to Trichophyton, this is a Trichophyton rubrum and mentagrophytes. So you can see tear-shaped microconidia along the hyphae, whereas mentagrophytes grape-like clusters of microconidia. So coming to Microsporum canis, you can see abundant thin-walled spindle-shaped macroconidia. So coming to gypsum, abundant thin-walled macroconidia you can see. Coming to Epidermophyton floccosum, you can see club-shaped macroconidia in clusters. So selection of infected hair for examination is facilitated by exposure to UV light. So infected hair will be fluorescent. Two types of hair infection may be distinguished in wet mounts: ectothrix, in which arthrospores are seen as sheaths surrounding the hair, and endothrix, in which the spores are inside the hair shaft. So coming to the culture, Sabro's dextrose agar with or without antibiotics. When the culture medium is incubated at 25 to 30 degrees centigrade for 3 weeks, so identification of dermatophytes is based on colony morphology, pigment production, micro and macroconidia. So we will see colony characters for one of the species of Trichophyton rubrum. White to creamy cotton growth we can see, and reverse of medium is red in Trichophyton rubrum. So coming to the differentiation at species level of Trichophyton, we will see, for example, Trichophyton rubrum and mentagrophytes. So we can see tear-shaped microconidia along the hyphae. So we can see tear-shaped microconidia along the hyphae, and urease negative, and reverse of medium is red, and club-shaped thin-walled microconidia are scanty. So coming to the Trichophyton mentagrophytes, grape-like clusters of microconidia, and urease positive, hair perforation test is positive, no red pigment on reverse of medium like Trichophyton rubrum, and cigar-shaped macroconidia. You can see uh, grape-like clusters of microconidia. So some characters of common characteristics of common dermatophytes. For we have seen already for Trichophyton rubrum and Mentogrophytes. So these are for other species. So we have seen for gypsum powdery, buff colored. So we have seen so we can see powdery buff colored growth on culture medium and abundant thin walled macroconidia with 4 to 6 septa. So once go through this for other species characteristics of dermatophytes. So coming to the microscopy, when we do lactophenol cotton blue preparation, so for trichophyton species we can see more of microconidia and very few macroconidia. For microsporum we can see predominant macroconidia, whereas epidermophyton we can see uh, macroconidia. And the treatment is oral griseofulvin is the drug of choice. So done with dermatophytes. This can be asked in your examination. Very important fungi. So go through it and uh, yeah, I am doing these topics for BSc MLT students. And the next topic I am coming up with another examples of moles. And yeah, all the best for your examination. Thank you.